Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Thanks for being here for Valley Health Minutes. You know, getting your kids to the doctor, it can be really tough if you're a working parent or just trying to get in with the schedule, but there is something that can help you, school-based health centers. Valley Health is in several schools in our area with school-based health centers, and today we're talking about what that exactly is and how that can help your family's life and schedule. So we're talking with family nurse practitioner Candace Vinson about that. Thanks for being here.
Yes, thank you.
Tell us what exactly a school-based health center is and how can you help when your child is sick or just even with routine visits?
So we are in Cabell, Lincoln, and Wayne counties, just depending on the county of what we're in. Cabell County, we are at Huntington High, Cabell Midland, Wayne County, Spring Valley High, and Wayne High, and then Lincoln County, we're at Harts Pre-K through 8. We do well visits, we can do sick visits, sports physicals, immunizations there. It's really good as far as getting the kids in and out. We can get them right back to class. It's not something that they're missing a full day of school. And we're treating them. We can send them prescriptions, diagnosing, and being in contact with the parent. The parent doesn't necessarily have to be there. They can be there if they want to be. But we are in contact with them, letting them know they're there, and we're calling them to let them know, you know, this is what we did, this is what we saw, if medication was needed, and kind of go from there.
Mm-hmm. Interesting that you wouldn't have to rush to school, pick up your child, and then rush to the doctor because the health center is inside the school.
Right.
It makes it a lot easier. Just streamline it. I know that you do all kinds of things. You mentioned well child visits, but even if your child has a headache, sometimes they can just get ibuprofen at school because they can't carry that anymore.
Right, right. So we can see them, they can get medication like that. Even if it's, you know, I have a sore throat, mom wants me to be treated for strep, check for strep. We can check them. If everything's negative, they can go back to class. If we do find out that they have strep, we can give them medication. We would call you because they would technically be contagious at that point. So you would be able to come and pick them up, and we would give them a doctor's excuse for the rest of the day. No. So simple things like that.
And streamline the process. Now, how does it complement other pediatric care in other offices?
So it's just like an extension of our services, just like the urgent cares. You know, you're not always able to get into that pediatrician's office, and especially if your pediatrician is with Valley Health, they can get on and see that you were seen there, what was done, the medications that were given. So it kind of gives that provider like an overall well-rounded view of what was done. And we work really closely with our providers also.
So who has access to the school-based health centers?
So access is any of the faculty, even their spouses can come in, siblings and students are all welcome to come in.
School-based centers can help with medical, but also with mental health services.
Yes, we are seeing a lot of children that are needing more and more mental health services, therapy, counseling, and we have now in Wayne County seen a lot of success with our therapists. We have a therapist named Kayla Michaels. She is there, and it's so easy. Like, I can just place a referral, and we work so closely together. I can even just walk down the hall and speak with her and say, listen, this patient needs to be seen, kind of tell her what's going on, and the parents are aware, they're in connection the whole time, and it gets that child those services also at school. The parents aren't trying to take them to those appointments and work out their schedule. It's all getting done there at school, and it's really been really great.
Where can you learn more about whether your school has a school-based health center? Because a lot of people may not be aware.
Right. I've even been in conversations with people that went to like Huntington High and Wayne High that went there the whole time, never knew that we were there. So your school would be a great resource. You know, the principals, we work very closely with our principals, so they would know our hours, but you can also get on valleyhealth.org. We have our own little section on there, school-based centers. The providers are on there, our numbers are on there for each of the sites and our hours, and we work with really close group of women, and they're all really great to help. So if there's ever any questions or any concerns, reach out to any of them and we would be glad to help.
Yeah, it's nice to have that access right there where your kid,
yeah,
where your child already is. It's so helpful. Candace, thank you so much. We sure appreciate it.
Thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.